Rheumatoid arthritis doesn't always begin with pain. In many people, the early signs are vague, easy to brush off or explain away. But spotting those signs early can make a big difference in how the condition progresses and how much it affects your daily life. Rheumatoid arthritis, often called RA, is a condition where the immune system starts reacting to your joints as if they don't belong. It doesn't start from injury or aging. It starts from within. This immune response causes swelling inside the joints, and over time that irritation can wear away bone and joint surfaces if not addressed early. RA can affect people at any age, and it doesn't always appear the same way for everyone. That's why these first symptoms are important to recognize. Let's walk through 7 of the most common early signs people tend to miss. 1. Daily joint tightness that lasts more than 30 minutes. If your fingers or wrists feel tight every morning and it takes a while before they move comfortably, pay attention. With rheumatoid arthritis, it lingers and resets every day. The discomfort doesn't fade quickly after getting up, and it's not just a slept wrong kind of feeling. It's repeatable and hard to ignore once you're looking for it. 2. Puffiness in smaller joints like hands and feet. One of the first visible signs of RA is swelling, especially in the small joints of your hands or the balls of your feet. It might not be severe at first, but you may notice it when your rings stop fitting, or your shoes feel tighter even when your weight hasn't changed. That slight puffiness is your body's immune system at work in places it shouldn't be. 3. Joint discomfort that appears on both sides. RA often affects both sides of your body at once. If one wrist starts bothering you and then the other follows soon after, or if both knees or both feet are feeling off in a similar way, that symmetry is worth noticing. Pain from everyday use usually sticks to one side, but with RA, it tends to occur in matching joints. 4. Constant lack of energy. One of the most common early experiences in RA is a kind of fatigue that doesn't make sense. You're not overdoing it. You're resting, but you still feel drained. This isn't a case of bad sleep or a busy week. Many people with early RA say they just don't feel like themselves, and that energy is the first thing to go. 5. A subtle sick feeling without obvious illness. Some people with early RA describe feeling a little off, like they're coming down with something, but the symptoms never really manifest. Mild fever, general discomfort, a feeling that your body is working harder than it should. These can be signs that your immune system is active, even if nothing looks wrong on the outside. 6. Losing weight. If you notice the number on the scale dropping and nothing in your diet or lifestyle has changed, it could be related to underlying inflammation. When the immune system is active long-term, it can affect how your body uses energy, even when you're eating normally. This can be an early sign of something more systemic, like RA. 7. Pins and needles in fingers or toes. RA inflammation can sometimes put pressure on nerves, especially in the wrist, and that can lead to tingling or numbness in your hands or feet. If you're noticing strange sensations like this, and especially if they come with joint pain, it's time to take a closer look. So, how do you respond if you notice these signs? If 2 or more of these symptoms sound familiar and they've been happening consistently, it's time to speak with your doctor. Ask about rheumatoid arthritis directly. Don't wait for things to get worse. Request the right tests, rheumatoid factor, anti-CCP, ESR, or CRP. And if needed, get imaging done on the joints that are bothering you. The earlier RA is diagnosed, the more options you'll have to manage it effectively. If you're not sure what's going on, write things down. When do the symptoms happen? Which joints are involved? How long does it take to feel better? A simple notebook or note on your phone can help your doctor spot patterns and speed up the diagnostic process. Let's quickly recap these 7 early symptoms. 1. Joint tightness in the morning that takes a while to ease. 2. Swelling or puffiness in the hands, feet, or fingers. 3. Pain or soreness in the same joints on both sides. 4. Low energy that doesn't go away with rest. 5. Feeling unwell without a clear reason. 6. Unexpected weight loss. 7. Tingling or numbness in fingers and toes. These signs may seem minor, but they often appear before full-blown symptoms. The earlier you catch them, the more you can do to slow the process and protect your joints. We post helpful health videos every single day, including practical ways to manage chronic conditions like rheumatoid arthritis. So if this was helpful, hit subscribe and turn on the notification bell so you don't miss out. And if you haven't seen our video on the mistakes people make about rheumatoid arthritis, watch that next. It's linked here on the screen. Take care, and I'll see you in the next video.